I'm Dr. George Flynn. You're watching In-Depth TV, and there's been so many questions about Botox and fillers and all kind of cosmetic, aesthetic wellness that I've brought an expert on with us, Heidi Schaefer. She's a former county commissioner in Shelby County, but she is running and she's a chief operating officer at the skin clinics. And so many people come in and have misconceptions about what these procedures, what these materials can do and what they cannot do, and the dangers of them and not dangers of them. And people are always afraid of things until you know more. And that's what this is about, for you to learn more about the procedures. Heidi, welcome to the show.
Thank you. Thank you
First,
for having me.
and when you're at the skin clinic, what is people come in? Are they nervous? Are they pretty well educated on Botox and fillers and microneedling and these kind of things? Or it's so much out there. Can you help clarify some of the things that are out there and are available?
Well, thank you and that's a really good question. Thank you for asking that, because what a lot of people come in for first is for Botox. And Botox has almost become kind of a generic name, like Band-Aids, right? Or Kleenex. And people are saying, oh, I might need some Botox. I might need some around my mouth. And because they have lines around their mouth. And what we try to gently teach them about is that Botox is a muscle relaxant. It paralyzes muscles for a short amount of time. And you sure don't want to paralyze the muscles around your mouth strategically, because otherwise you'll have that post-dentist thing where you're dribbling orange juice and soup down your mouth.
So it takes a professional to do this. You've got to know what you're doing and where to inject the Botox. And people say, well, paralyze my muscle. Does it really, is it permanent? Is it temporary? What is the paralysis?
It's temporary, and about every 3 months, 3 to 4 months, people will come in for new, and there are different kinds of neurotoxins, which is what you're what you're talking about. The brand name one is Botox, and then there is also another one that's got a different mechanism to it that's called Dysport, and then there's another one that's Xeomin, and there is a new toxin coming on the market. So it's such a popular thing because they've been able to take something that's deadly, botulinum toxin, and turn it into something that can actually help you prevent you from creating wrinkles to begin with.
Well, the wrinkles, and that's what people are after, is to get rid of the wrinkles. And what it does, from my understanding, is it weakens or almost paralyzes the muscles that cause the wrinkles. Therefore, the wrinkles are either diminished or, in some cases, go away. So what areas of the face do people use Botox?
Well, the main one is right here, which are called the glabellar lines, but people refer to them as the 11s because think of when your mom was real mad and she'd knit her brows together and you'd get those parallel lines right between your eyebrows. It makes people look angry and makes them look old. And that was the thing that they first started doing once they realized the capabilities that Botox had. They realized they could relax that and keep people from looking angry even when they were perfectly happy. It's just something that happens with age. And so I'm 53, and I've really appreciated it because I noticed that when my Botox starts to wear off, and I only use the real Botox, when mine starts to wear off, people are like, oh, are you upset? Are you angry? You know, and it's not. It's just
but they use them on the forehead too, don't
Yes,
they?
you can use them on, there's on-label and off-label things. So what's on-label is for the glabellar lines, and then also a little bit for the crow's feet here around the eyes. But good practitioners know how to strategically place Botox so that you won't look frozen. Here, we don't like that LA look, that frozen, overly inflated mannequin look, right? We like a really natural look, and a good practitioner will be able to inject it just the right place where you won't get your brows dropping, where you'll just look refreshed. But I want people to understand, you don't want just anybody injecting you. You've got valuable vessels and veins and things in your face. There's a lot more to it Do your
So
research.
things can go wrong
Things can go very
if you
badly
don't
wrong.
really know what you're doing.
Yes.
Botox. Now,
Mhm.
from what I've read some things about it, I understand that in some studies, Botox, because you can't look angry, people are in a better mood. Have you seen the mood changes in some of the patients that you've done? Because if you can't look angry, you're not angry. And that is, I think is part of the thing, and I've also seen Botox used for migraine headaches, a trigger point. So it's used in medicine, it's used in aesthetics, and it's a good combination of things to use this material for.
It is. It's a tool. And I can speak anecdotally because I noticed that once I'm kind of a worrier, right? And you can even worry in your sleep.
Mhm.
And I found out that when I wasn't able to frown, it helped me be a little more even with my moods. Kind of like if you're ever in a bad mood and
Right.
you hear people say how to get yourself out of a bad mood, funk, smile.
Mhm.
There's something about the way God made us, right? That when we smile,
Right.
it helps your body feel happy even if you're not. Conversely, if you're frowning and
Right.
angry, even if you're not, it can make your mood seem
Right.
darker.
Yeah, it's your body telling your brain, hey, you must be in a bad mood, they're frowning. So we've talked about Botox. Now, we started out with the lines around the lips. What do you do about that?
So that's filler. And a lot of the same companies that make the neurotoxins like Botox also make really good fillers. And fillers are generally made out of hyaluronic acid, which is something your body normally produces, but that dissipates. Starting about age 20,
Mhm.
you lose some hyaluronic acid every
Okay.
year. And it's what gives you part of what gives your face the fullness. And so a good filler, the fillers that I like to use are made out of hyaluronic acid, which is a natural material. And then it just restores the fullness. And there's thicker versions of it and thinner versions. So for if you've got smokers lines, or we call them kissers lines sometimes, some people call them barcodes, where you've got those lines up and down. Gum chewers get them a lot. If you've got those, a really thin filler can be a perfect thing there just to flush those out, and then they're not as noticeable. And then possibly you'd want a little tiny a unit or two of Botox a couple places if you also have a gummy smile, where your smile is
Right.
big and you're showing more of your gums than you want.
And there's a lot of things, a lot of people I've seen, especially in Los Angeles, that have lips that have been way overdone. What is the story with injecting lips, and how do you keep from overdoing it? Because they look very unnatural if they're overdone.
Yes, and different parts of the country like a different look. So LA loves that look. It's like a status symbol. Nashville has a little bit of a more inflated look than we happen to like here
Pouty
in the
look.
Mid-South. Yeah,
Pouty look.
thank you.
Okay.
But there's also a weird thing where people are altering the ratio of lips. The divine ratio is what they call it, is where your lower lip is, I think, 2/3 fuller than your upper lip. And
Okay.
that's always been the standard of beauty. But some people are filling the upper lip really, really full now to be equal or even bigger than. Some of that started, I think, because the fillers were so stiff that it made the upper lip look kind of like that. Now we've got more opportunity to use softer fillers for a more natural look, but some people really like that look. They call it a rich girl face.
All right. Well, how long do the fillers last? Botox lasts about 3 months. So what about the fillers?
So my experience with fillers is that they last about a year. I think the packaging is different. There are different kinds of fillers. They're the ones from Allergan. So those would be like your Voluma, your Juvederms. Then there are ones from companies like Galderma and Merz, and they each have different lengths of time that they'll last, and they each have their own injection techniques for where they sit and work best in the face. So you need a good practitioner who is familiar with all of them to see which one is going to work
Which
best
one's
for you.
best for you?
Yes.
Yeah.
I will tell you, if you're a very lean person, which I've never been blessed to be, right? If you're a very lean person and have a high metabolism, you're going to burn through your filler a lot faster.
Okay.
Yeah. and one thing I'd love to talk with you about before you go on to the next thing is there is a movement, it's in Canada and Mexico right now for some more permanent fillers that last about 5 years.
Mhm.
We need to proceed with caution on
Right.
those.
Because if there's an error there, you've got it for a long time.
Yes, and you can't back out. You can't put something in that eats it up.
Mhm.
The only thing you can do is kind of vacuum it out and try to resculpt it. And that to me is once it starts bonding to your
Right.
cellular level and everything, and you can't get it back out. Especially if the fact that it looks as if it travels a good bit, even years later, it
Mhm.
can travel. And you can start out with a beautifully shaped mouth or beautifully shaped cheeks, but if all of a sudden it starts scooching
Moving
down
that.
into here, you're not going to like it.
Right. Under the eyes.
Mm-hmm.
People complain about, say, you haven't got much sleep. You have bags under your eyes. Is there anything that can be done? We see about eye lifts and brow lifts and things like that. And what can be done without surgery?
So without surgery, radio frequency has got a great beginning in doing under eyes and just redensifying the material, retracting that and making it look more like it was when it was young. And then a really good injection practitioner, again, can also do tear trough injections very skillfully. And they can use a cannula or a regular needle and very carefully place either a line or some boluses of filler right there just to bump it right out. And again, that's something that you want to make sure that you're going to somebody with a whole lot of practice.
Now, you said needle, and everybody said needle. What are you talking? Needles are very small.
Oh, yeah.
You're talking about regular needle. You're talking about needles smaller than or equal to an insulin syringe.
Correct.
Very small
Yeah.
needles. You're not talking about the big needles for doing whatever it is, liposuction or anything.
Oh, yeah, correct. But I want people to be aware that they are infiltrating your skin.
Mhm.
And so you need somebody who is, you want the best for your face. This is, yes, your
Right.
man looks on the outward appearance, right? So people do look at your outward appearance, and you want not to be a sales shopper necessarily for what you're doing to your face.
And okay, let's talk for just a minute about microneedling. We've
Mhm.
heard about that. What does that involve?
So I love this because you remember, well, Doc, you and I are old enough now that we remember like 20 years ago when the best on the market was that you would put a cream on your skin and it was real heavy and it would basically hydrate or moisten your dead skin. Okay, and that was considered state of the art. What a few doctors like Dr. Rosenberg and Dr. Skinner had discovered, and now the rest of the technology is caught up with it, is that if you slightly damage the skin, it'll trigger a repair response to it.
Mhm.
And your own body will start producing its own hyaluronic acid and its own collagen and rebuild the skin. So microneedling, the ones we use have 36 needles in them, and it pokes little tiny microscopic almost channels in your skin, tricking your skin into thinking it's being damaged, and so it starts repairing itself.
So they're they're really microneedling.
They're very, very itty bitty holes. However, we tell people there is a very strict protocol after you've had it done because it is like creating a wound on your face. The channels are only open for about 5 minutes, but we're very precise about the cleanliness
Mhm.
and the aftercare for it, because you sure wouldn't want to get a staph infection or something on your
Right.
face from something that's supposed to make you beautiful.
Well, the microneedles I've seen, they're disposable. You use them once,
Yes.
throw them away. Use them once, throw them away.
Yes.
So the needles are never reused at all.
No, sir. But almost everybody now carries staph somewhere on
Right.
their body.
Right.
And so if you happen to brush your nose or somebody sneezes and it
Mhm.
happens to get in
Right.
your face, we just need to be aware. So the cleanliness is really important for taking care of your skin.
All right. Let's go to things like under the chin.
Mm-hmm.
Are they still doing procedures like that for diminishing under the chin.
Yes, and that's going to be the next thing that I'm getting done. Again, radio frequency seems to be the area that is developing the most right now. And I'm going to be getting some of the fat melted away here first by one radio frequency and then tightened up by another one to create a better
So
jawline.
it's done by radio frequency.
Mhm.
There was in the past something with injection.
Mhm.
Is that still done?
It is, but I think they're phasing it out as cool sculpting, which is a way of freezing fat.
I'm glad you were getting it because I was
Yeah.
getting ready to ask you about cool sculpting. It sounds
Yeah.
like a freezing topic to me, but
Yeah,
Okay.
it's a cool topic. But it freezes fat. And so between cool sculpting and the radio frequency, I think that the Kybella will probably move its way out of the marketplace as newer,
mhm.
more efficient things
That
work with it.
Kybella is the injection form of, in the radio frequency. What is involved in that?
So depending on the machine that you get, it can, there's a tightening machine that redensifies your skin, and it pokes little channels into your skin and then shoots radio
Mhm,
frequency waves, which you know a lot about, into the skin, into your deeper layers. And then there are other ones where you're penetrating the skin a little bit more and you're using the radio frequency to melt the fat
Okay.
and re-sculpt. And again, these are fairly sophisticated pieces of equipment, mostly developed in South
they are.
Korea.
Yeah.
And so you're going to want to make sure that the people who are using yours really, really know what they're doing and that they're good at aftercare and that you've got some good medical
Right.
background to follow up on.
Well, you've got radio frequency, you've got microneedling, you've got lasers.
Yes.
Tell me about lasers.
Well, so some people call every machine in a medical spa a laser, which is laser is a particular type of technology. And you're a former engineer, you'll be able to talk about the parameters of laser more, but it's light. And it's a light-based machine, an energy-based machine. And lasers hit at different depths, but they do certain things like laser hair removal is a huge, wonderful thing that can stop you from having to shave under your arms all the time or
Okay.
your legs. Laser skin resurfacing. There are erbiums where you can resurface your skin, help mitigate scars, help get rid of hyperpigmentation if you've got
Mhm.
dark spots. And then there's also IPL, which isn't a laser, but it's intense pulsed light.
IPL, that's one thing I wanted to cover, is the different forms of laser and what they do.
Yeah.
If somebody goes in and says, you got to treat it with IPL, what does that mean and what is it used for?
So IPL is used a lot to get rid of darker spots.
Mhm.
And here's the thing, you don't actually have to know what each one of the things does. Let your nurse or your practitioner tell you which machine is going to work best for you. There's also a Q switch, which can go after darker pigment. It's the same thing that's used on tattoos.
So there is a thing called tattoo removal.
Yes,
Very difficult to do.
yes.
Okay.
And by the way, remind me to talk with you about wave therapy, shock wave therapy too, because that plays into it. But Q switch can get some of the, and I'm pointing to my hand because I've had an age spot there that they've been breaking up with a Q switch. It's a tattoo.
Is it a laser?
It is a laser.
Okay.
And it gets down deep into the deep levels because, tattoos, a full tattoo goes many, many layers deep. And so if you've got a deep colored source of pigmentation, you want to go deep to break that up.
Mhm.
So they layered a Q switch with a regular 1064 laser, so dark, deep and medium to try to break up that dark spot for me.
So you have different laser amplitudes or different wavelengths to do different colors.
Yes, and then and then there's intense pulse light, which does still different things. And there's infrared light, energy. The different kinds of energy, radio frequency, light energy, all those kinds of things are just blossoming right now. It's a great opportunity, great time to look at your skin now.
Well, the laser therapy, what else does it do? It removes different areas that may be darker, maybe tattooed, maybe scarred. Is there anything for scars?
Yes, so microneedling actually can help break up some
You
scars.
can.
Yes, some laser can help with some scars. You want to be careful though. If you have scars that heal in a bump, that can either be called hypertrophic or keloid, and those two things aren't the same. But if your scars tend to heal in a bump, you want to be very careful about using laser, just because
Okay.
you don't want all of a sudden to create bumps.
Okay.
And again, rely on your practitioner to tell you which kind of energy is going to work best for you. Because if you're trying to self-prescribe, that's like me saying whether I need which kind of antibiotic I need, or do I need a CT or an MR or an ultrasound. Those are
Right.
things that a medical practitioner needs to tell you.
Now, we've heard of cool sculpting, but there's some other kind of sculpting for eyebrows. What is that? What is it, what is it called?
Microblading.
Microblading,
Okay.
yes.
So microblading is fun because it's a semi-permanent tattoo. So it's a tattoo-like technique, but it only lasts about a year. If your skin turns over really
And
quickly, it
where do
might be
they
a little
do
less.
this? I mean, where is it on for eyebrows, or what is it for?
For eyebrows is what most people are using it for right now, to give you kind of a 3D defined eyebrow look. And you never know how important eyebrows are until you see somebody without eyebrows. I went to school with a girl who was from Africa. She was raised over with missionaries, and she thought her eyebrows were too thick, and she ended up mistakenly shaving them all off. And I can't tell you what a difference it makes
They're
when you
very,
yeah.
sometimes they don't come back.
Yes. And it makes a big difference if you don't have eyebrows. And shoot, we live in this Instagram society now where
Right.
everything's about your picture. Beautiful eyebrows frame your face and make your eyes really stand out. So a lot of people are going for just having that really nice all the time look where you don't have to pencil them in. When you're about my age, sometimes your hair starts thinning out. You can start losing some of your eyebrows. And so I've had my eyebrows microbladed, so I don't have to mess with them every morning. Now they're just there, and then about once a year I go in and have them redone.
And there's something about eyelashes too. There's some compound or some material you can put on your eyelashes to make them a little more outstanding. What is that?
So my favorite is Latisse, and that's by Allergan, and it was developed by accident.
Sure.
It was, they noticed that they were using this product. They were using it for macular degeneration, I think.
Okay.
And anyway, they were putting it on eyes, and one of their people at their front desk noticed that he just had it in one eye, and all of a sudden I think it was, eyelashes started growing really huge and long on that one eye. And of course, Allergan, being a pretty savvy company, said this is something that's fabulous. It will produce longer, thicker, and darker lashes. And there are some other products out there like Grande Lash, and there's some things by Zeo. There's various different places that can do things that will help feed your lashes so that they have a better chance of growing.
Okay, now we've talked about procedures, we've talked about Botox and fillers and things like that. What about products that you put on your face? Do you just go to the discount place and get some cream and put on there? What is the difference in that and custom-made or professional products?
So that's a really good question, and people can waste a lot of money. Before I got into this business, I thought that if something said it had hyaluronic acid in it, or if it had retinol in it, it would all kind of be the same. The products that a really good medical aesthetic spa will sell you are medical grade products. That means that it's going to cause a reaction in your skin to get your skin to change. They can't really sell those kinds of things over the counter at your regular five and dime, fill in the blank drugstore, even your nicer department stores, because there's nobody medically trained to follow up to make sure that that reaction that you're having is normal. Right? So when you get a medical grade product, that means that it needs to be overseen by a physician or somebody medically trained, like a nurse practitioner, physician's assistant. And those products will create a change in your skin. And they've done so much development and research that it is amazing what just those products alone, without ever having a
Yeah.
needle or a machine with energy touch your face, they can
Oh,
really do
really?
some great things. Yeah.
So people that come in to see you for a consultation or see somebody, they're not necessarily going to get Botox, and you may say you don't need anything but these products.
Right. That's exactly right. And there's something for every budget. So some people think that we're going to be, anybody in the medical aesthetics field is going to be a lot more expensive. But with most of these products, you use such a small amount and
Right.
they've got such a higher concentration of the active ingredient in it that you will end up spending the same or less as if you went to just a regular over-the-counter place and got something that might work, but it might take 6 months to a year to get any kind of result.
Mhm.
Whereas, a lot of the medical grade products you can see results in 2 weeks, 4 weeks, 6 weeks, that kind of thing. So it just depends on your budget, how much time you have, how degraded your skin is, and we should probably talk about sunblocks before we.
We
Yeah.
definitely will in the last couple of minutes, but I want you to take just a minute or two to talk about peels.
Okay.
Tell me about, people talk about, well, I had a peel and everything, and I looked like I was shedding skin for a long time. Peels need to be controlled, don't they?
They do, and you're taking off a very necessary layer of your skin. So, and it can be important. You want to peel down underneath some of the sun damage, but if you do that, and we do peels, and it's a good practice to do. But I want everybody to be aware you must stay covered from the sun, and not just any sun. Anytime you don't need a flashlight to see, you can still be getting damaging rays. When you peel off that top layer, your stratum corneum, then you've kind of taken off your shell, like you're a turtle, or you're a turtle
Right.
without a shell. So you need to replace that either with a physical sunblock, like a stay inside,
Right.
away from windows, or with a hat. But you also need a sheer sunblock with a titanium or a zinc oxide in it that's micronized. And you need to reapply it every 90 minutes.
How long does it take to recover from a peel like that? How long do you need to stay in from the sun as well?
To re-epithelialize, I think it's like we're recommending really to be careful with it for about a week.
Okay.
But you should, as a good practice, wear a sunblock every day. And so here's a little hint for the women out there, because we wear makeup and nobody I know reapplies their makeup every
Right.
2 hours, right? So there are some, again, micronized sunscreens that you could spray on over your makeup
Okay.
and just pat them in there, and then you don't have to reapply the makeup. Carry it in your car. This is the side of your face. In America, we drive on the side where this is always going to get the sunlight. You get more skin cancers on this side of your face and your
Okay.
hands. You want to be blocked and protected from that.
Okay. Well, I really appreciate you being here, and you see people at the skin clinic, and it's just they really come in. Do they go out happy?
It's the most fun business because it's something that we can take. It's a little ministry to people and make them feel better about themselves, because everybody can do something to make themselves feel better and look better. And it's really not even a matter of budget.
So it's not this vanity kind of thing. It's actually makes you feel better, makes you do better with your family, makes you just feel better about life.
Absolutely. And I don't think we should feel guilty about wanting to look the best we can. That's a normal human impulse, is to look good. And you don't need to be Narcissus and spend all the time looking in the water for your reflection. But when you feel like you've got a face that looks friendly and
Right.
represents the person you are, you're going to perform so much better. And then you'll quit thinking about yourself and think about others.
Well, thank you very much for being here. Heidi Schaefer, Chief Operating Officer at the Skin Clinics. And if you've got any questions, we'll put her number or contact at the bottom of the screen. And we'll see you next time. And I want to smile on that face. I'm George Flynn. You've been watching In-Depth TV. Thank you for watching. We'll see you next time.